Hello everyone, welcome back to the channel at Boulder Pain Relief Massage, LLC here in Boulder, Colorado, where I like to share my expertise around soft tissue and help people reduce the frequency of pain, but also understand what's going on with their bodies a little bit more. So today's a very important question. I get this question a lot. You know, people will go and see a doctor or a PT, an acupuncturist, a massage therapist like myself, and then they'll be surprised that the pain comes back or their pain pattern if it's involving more than one area. And so a lot of people ask, why does this keep happening? And one of the ways I like to describe this is fairly complex, but I like to give some simple examples, is if you think about a bathtub. I have a child, and so I think about bath time. If you think about a bathtub and you're trying to drain a full bathtub, I often ask my clients and patients, what do you think is one of the most important steps to do if you're trying to drain a tub or a sink, or pick your example? And a lot of people will say, take the plug out, let's empty it. And I think the first thing is to turn the water off. Let's find out what's causing those patterns. And so the way that I think about this with soft tissue is I do a lot of teaching. And so when I'm working with people, and this is part of why I am in this field, mentorship out of Seattle really changed my understanding of my own body and how to use it. And that's part of why I like to teach, so that if we can help people reduce the pain first, then help them understand what's happening, then they're more likely to be involved in their movement patterns and then reduce the likelihood of the pain actually happening. So let me give an example. Let's say my right shoulder, let's say it hurts. And we have certain patterns in our life. Let's say I have difficulty moving my shoulder, or I have pain on the top or pain in the back. And we're feeling some pain every time we move. An old mentor of mine gave me this phrase, and I like to use it a lot. He'd say, well, you've already paid the price. You might as well get the lesson. And so if the pain isn't excruciating, if it's kind of low grade, how can we learn from it? If I move my shoulder in a certain way and I feel pain, well, in real time, my body is teaching me about my pain pattern. And it is basic musculoskeletal anatomy and kinesiology 101. When I move this, it hurts here. This is involved in that action, and that's teaching me about that. And so one simple example, if we're just using the right shoulder, is if I have pain and I go and get a really good massage or see a good PT or a provider, and they're able to help reduce that pain, the next thing I want to notice is, when do I feel that pain in my life? Do I feel that as I'm reaching for a cup of coffee, looking at my phone hundreds or thousands of times a day, reaching for a car door? Because if we can notice when we feel that pain after it's gotten better, then we can become more informed about how we're using our body to reduce that pain happening. And so a lot of times the reason the pain comes back is because we haven't changed anything. We're still moving the same way, we still reach for things the same way, we still lift or grab or work out in the same way, but we haven't modified our movement patterns. And so a long way of saying the reason that pain comes back after it's gone in a body is we continue to move the body in ways that are injurious. Whether it's a big movement pattern, lifting something extremely heavy or doing a hard effort, or it's just the way that we reach for our phone or do repetitive tasks hundreds or thousands of times a day. So how can we use our pain to better understand and move differently so that we start improving our body, reduce the frequency of micro injuries, and feel better? So ideally, we can learn from our body and our pain. I hope that answers your questions. Please like and subscribe. If you have more questions that I have not yet answered, or you'd like more information about the topics that I have already answered, please leave those in the comments below, and I will get to them as soon as I can. Thank you for watching, and I hope you have a pain-free day.